Are you a woman wondering if she might have premenstrual dysphoric disorder? My name's Dr. Ruth Dotton. I'm a board-certified adult psychiatrist, and I have women coming into my practice all the time wondering if the symptoms that they're experiencing every month are normal or if there's something else going on. So first, let's talk a little bit about physiology. So there are two main periods during a menstrual cycle. Let's assume a 28-day cycle. So during those first 2 weeks is the follicular phase. During this phase, estrogen is the predominant hormone, and in a lot of ways, a woman's physiology is more similar to a man's during this time. So think about in terms of their dietary needs and exercise tolerance, things like that. Then at that 2-week mark, that's when you have a surge of LH and FSH, and you also have surges in estrogen. So all of the hormones kind of go wild really quickly, and then you have the release of the egg, and then starts the luteal phase. And during this luteal phase, progesterone is the dominant hormone, and it's going to steadily increase over this 2-week period. So symptoms that can be common and normal during this period include things like increased irritability, decreased tolerance for stress, increased appetite, especially cravings for things like carbohydrates, decreased exercise tolerance or desire for exercise, fatigue, and generally a woman is much more sensitive to stressors on her body, either physical or emotional, because of the progesterone being the dominant hormone. So essentially a woman has to be treated a little differently during this time. So generally these symptoms are going to gradually get more intense over that last week of the 4-week cycle, and will start to get better once the menstrual cycle starts. And that's when the cycle starts over again. So the follicular phase would start over again. And so usually by day 3 or so of the menstrual cycle, these symptoms are significantly better. So to some extent, all of these things are normal. So when it comes to whether or not these symptoms might be something like premenstrual dysphoric disorder, it really comes down to how long they last, how intense they are, and if they're causing functional impairment. So if these symptoms last for a couple of days, they're not causing you to miss work, they're not causing any major rifts in your relationships, they're not causing really any significant functional impairment, I would just chalk that up to a normal reaction to the hormonal fluctuations of a menstrual cycle. If, however, you're missing days of work because of the symptoms, you're having major conflict with your partner every single time you're at this phase of your cycle, you're worried that you're traumatizing your kids, or maybe you're having really intense negative thoughts that are scaring you, or you have a pre-existing psychiatric condition like depression or bipolar disorder or anxiety, and those symptoms are getting significantly worse every time you're at this phase of your cycle, those would all be reasons to seek some help. Now, treatment could be in the form of therapy or psychiatric medications or somatic medications or lifestyle changes. We can talk more about that in another video. But the first step is knowing whether or not what you're experiencing is normal or maybe reason for concern. So hopefully this video provided some reassurance to some and some clarity to others. If you have any questions or comments, feel free to add in the comment section below.